Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor and your host.
Happy Rare Disease Day, everybody. For those watching on YouTube, I'm wearing my stripes for Rare Disease Day. And I'm very excited to be joined by parents and patient advocates, Caleb and Abbi Wahl, who are parents of two daughters, one of whom has been diagnosed with a rare disease, Wiedemann-Steiner Syndrome. So we're going to get into their diagnostic odyssey, what life looks like with Wiedemann-Steiner Syndrome, and the incredible advocacy work that they've been doing to ensure that every family has access to information and the community they need. So happy Rare Disease Day, Caleb and Abbi. Thank you so much for joining us.
Thank you for having us.
Yeah, thank you for having us. And yes, happy Rare Disease Day.
Yeah. And for those also watching on YouTube, Abbi has this great sweatshirt on I'm going to make you show the sweatshirt. And it's for your daughter's rare disease that we're going to be talking about today. Let's start at the beginning. When Jenni Anne is your daughter that has the condition, right? When did you first notice that something was a little bit different? What stood out to you that started your diagnostic odyssey, as so many rare disease parents end up going down?
Yes, I would say pretty much from the beginning. Jenni Anne was born prematurely. And so at the very beginning, that was kind of what everybody kind of held into was, it's okay, she's preemie, she'll grow out of it. She was born low birth weight, but it wasn't anything that really alerted the doctors. I would say she was in the NICU for about 10 days at birth, and it was primarily because of her low birth weight mixed with reflux, which a lot of babies have reflux, but when you're 4 pounds, 13 ounces, you can't really afford to lose any more weight. But she thrived. Once she was in the NICU, she gained weight, she was able to eat. And so she was making progress, and she just was on her own curve. She was always low birth weight or in low weight, but was on her own little curve, and she continued to grow on that curve. That was one of the first things that I think we noticed. Another one, especially for him, was her eyes. And so because she was early, we just thought that was the reason, but it took her a while to even be able to open her eyes. And it was very droopy. And so that was something that it kind of raised a red flag to us. We went to the pediatrician. They said, oh, she'll outgrow it. But then it happened to be one Saturday, and we went to a pediatrician that wasn't our normal one. He was just within the practice. And we went in for the reflux. It wasn't stopping, changing formulas, which is all normal things.
Sure.
And so, but then he noticed her sacral dimple, which we did have a concern about, and we're told, it was okay. He was like, why hasn't she seen an ophthalmologist? Why haven't y'all seen neurology or gotten an MRI? And then we were like, oh, this is something.
Yeah, he wasn't even concerned about what we came in for.
No.
It was, right away.
How old was she at this point then?
A couple months old.
Okay.
She was about 2 or 3 months old at this point. Her first surgery was at 6 months. And so she was about 2 or 3 months old at this point. But everything was kind of judged on that adjusted growth for the prematurity. And, but then we were like, okay, we need to switch doctors. So we continued with this pediatrician who he really felt like he was like, okay, I want to see her back in 2 weeks. And he constantly was checking on her. And we just knew that he truly did care and understood. From then, the specialists that we were recommended were phenomenal. And it was the recommendations kept going. One specialist would recommend another one, and it kind of all evolved. But I would say that her eyes were one of the biggest ones. And when they kept saying, oh, her eyes are really wide set, or she has a wide bridge nose, but I was like, well, Dad has a wide bridge nose, so we just
assumed. Part of it is just looking at the parents.
Yes.
Yeah.
So we
I say that to patients a lot. Yeah.
And so we were like, oh, we didn't really think anything of it. But I would say that the eyes were definitely part of what initially concerned us, and then the sacral dimple. And once we got the MRI with that, they realized it was benign and there was no concerns. And so we had spoken with a neurosurgeon, and he checked everything out. But they did with that one, we did find out that there was delayed myelination and a little thinning on her corpus callosum. And so that was something that They continued to check every about 6 months or so, and just would go back and kind of check it out, see how it was growing and changing. But it was never anything that brought concern. It was just, she's premature. This is something that we're going to keep an eye on.
Of just, we're going to pay attention to this.
Yes.
And then, as you said, at 6 months, she had her first surgery. So what was the
Yes.
surgery for?
So that was the surgery with her ophthalmologist, who ended up becoming one of our biggest advocates, which you wouldn't think with ophthalmology.
Yeah,
So, and he says that often too. He's like, I'm just an ophthalmologist.
Right.
But that was something that he was one of the first ones that kind of got us to seek out genetics.
So for a lot of genetic conditions, we see that things are usually bilateral, so both sides. And to me, as a prenatal genetic counselor, if we see anything that's bilateral, like an ultrasound, I'm like, ooh, I'm now thinking of a genetic condition. But from what I've started learning about this condition is that it can affect just one side. Is that what happened to Jenni Anne?
Yes. So her strabismus, her ptosis, her just developmental milestones, everything was kind of her right side had a hard time catching up to the left side. So her right eye took longer to open. Her ptosis was on her right eye. Her strabismus was on her right eye. And when she started reaching for things, she always reached with her left, and her right kind of just stayed. And so when we started getting Babies Can't Wait with our Birth to 3 program, they kind of mentioned that she resembled a baby who had had an in utero stroke. But her MRIs, nothing ever showed up that she had had an in utero stroke. So they kind of treated it as somebody that had that just so that they could, for the therapies and things. But nothing seemed right. Nothing clicked. Like there was no answer. And everything kind of just piled up. We had the eyes, we had that strabismus, we had the sacral dimple.
Milestones. She wasn't crawling. She'd actually get on her back and scoot across the floor on her back, and which we thought we were cute until we did The Babies Can't Wait, and they're like, "That's not a cute thing to see. That's not a normal. Yeah. We need to start."
But we don't want to see it developmentally.
Yes.
It's both.
We were like, oh,
right.
We didn't realize that, but with Babies Can't Wait, we started it because she had torticollis. And so when the torticollis kind of hit and the walking delayed, she was about 9 months old. She had her first seizure, which was a febrile seizure. And we took her to the emergency room, and they discovered that she had a UTI. And so at this point, she had had a couple different eye surgeries. She always was sick respiratory. So there was that. Then we ended up with the seizure. Then suddenly monthly fevers started happening. And that's when her ophthalmologist told us, I think you guys need to see genetics. And he mentioned the wide bridge nose, the eyes. He mentioned the right side. And he was like, with a child who has one or two of these things, it's not abnormal. But when you have everything and you keep piling up, specialist, I think that you need to see genetics.
As soon as we have a compilation of features.
Yes.
And it's hard because so much of what you're describing, not everything, but a lot of it is so general and generic where it doesn't point to something in particular. And even though, you're praising all of these healthcare providers you had, especially the ophthalmologist, of stepping in being like, hey, we need to follow up with this. It still took you 7 years to get a diagnosis.
It did.
So even with all of these amazing healthcare providers, it still took so long. Can you share what that was like of just going through and having new symptoms come up? And then, as you said, feeling like, okay, we're kind of taking a symptom and then trying to treat that independently. But it sounds like in the back of both of your minds, you were like, yeah, but what's going on?
Yes. So we kind of knew just in a gut instinct that something wasn't right, especially when she started getting older. She was really talking and having speech before she walked. But then when she started walking, she really stopped talking a lot. And the therapist mentioned that that's very common, like if they're focusing on one thing. But then we started getting into the hitting our chin and some of the behaviors because she couldn't process and couldn't verbalize what she was thinking. And so that's what they had told us. We looked into autism thinking that that was going to be our next diagnosis. But then they kept saying she was too social. She didn't have what it took to qualify because of her social skills, because she is so social. Even at 2 years old, she never met a stranger. When she could learn to talk, she knew everybody's names, could tell you where they were, who they belonged to. And so then you had this to where you would have those positives that ended up outweighing the negatives. But in the back of our mind, we would still have overstimulation meltdowns and different things, struggle with school and preschool.
Yeah, so the preschool part, that's when we started trying to, we kept thinking it was probably genetics, but we kept telling, preemie, corpus callosum, delayed myelination, the pre-K she was at, it was like the Christmas break time, like, we don't know if we can accommodate her for the next semester, so you guys may have to find somewhere else. So we took that as a cue. Okay, well, we may have some more stuff going on. Then Abby's family, they were in daycare business for almost 50 years. We're like, well, we were trying to not have her go to the daycare there to see if that would, maybe help with some of the behavior.
And she had been going to our family center. And like, we thought, well, maybe if she has something different, that it would be able to allow her to get a different environment and stuff, because she grew up there. So she knew everybody. And
Right.
it was
kind of like being at home.
Yes,
it wasn't as stimulating in that sense. Yeah.
Exactly. But we never saw a lot of that there because she was so just at home. And it was, the teachers became like grandparents, aunts, and so it became comfortable. And then when we decided to, when we started seeing some of the things in school, and it was more so just overstimulation and frustration and the hitting the chin, or the, what we now see is like the stimming or the tics. A lot of that started, and where we didn't see it before. And that's when we decided to call a developmental pediatrician. And when we spoke with him, he looked into everything, and it took us about 7 months to get on a wait list. But I called almost every month seeing if there was an opening. And then 1 month there was an opening, and we went in, and it was a lot of extensive testing and things, but he was so incredibly understanding. But then still, that was when she was 5, and it was still a year and a half later that we ended up getting the diagnosis.
They did the full exome testing.
Yeah, so she was 2 when she got the full exome testing, and we came back like when the doctor had sent us to genetics, and it came back saying everything was okay.
The exome was normal.
Mm-hmm.
Nothing was found.
Nothing.
Interesting.
And so we did have little things like vitamin B, or like some little things here and there. She can't have this medication, that kind of stuff. They said that BRCA wasn't an issue. So it was more of those things that we got back from the 2 different types of testing they did.
So then how did you get the diagnosis? Because I'm thinking it's going to come from the exome. So I'm really surprised.
No. Well, eventually we started thinking she was having seizures, but it was a medication that she was on.
Okay.
And they were causing like absent seizures, like what we thought. The EEG came back fine. And so we go back to her neurologist, and it was a physician's assistant, not even a neurologist. And I was
they
like,
often save the day. The physician assistant, I love getting a physician assistant
She's
myself.
our godsend.
Yes.
Yeah. Yes. She ended up telling us she thinks it's genetic. And I was like, no, we already went down that route. It's not. She's like, well, I still would like to do this. And I was like, no. Like in my mind, I'm thinking, we finally were told it's a genesis of the corpus callosum. We are finally told it's sensory processing. We finally have an answer, and you're telling me that answer is not correct. So it was a little frustrating, but we did it. And then we ended up getting a call, and on the phone, I remember exactly where I was. The assistant on the phone said that we needed to come in and schedule an appointment because they found out that she has something called Wiedemann-Steiner Syndrome. And I said, what is that? And she said, I don't know. That's just what the results say. So of course I went to Dr. Google, which I should not have gone to. But the thing is there was nothing really there. And so initially what hit me was just, we knew it and it was an answer, but then it was like, there's really nothing here. There was no information.
You got a diagnosis, and then it was like, that's it. Mm-hmm. At least before the appointment.
Yes. And so we went to the appointment, and she let us know what it was. And we had 2 pieces of paper. One was with basically just the genetic code on it. And then the other one was a printout of like some symptoms and a textbook definition of it.
So not very helpful, and something you probably was on the first page of Google, I'm thinking.
Yes.
Of the
Yes.
search
And
results.
exactly what I saw on Google. And so, but when she gave it to us, she was like, and she was great. She was like, I went on, there's a foundation website. I went on and I looked this up. And when she gave it to us and she started reading the symptoms, it was like, oh my gosh. Like the
that's
hairy
Jenni
arms.
Anne
Yes.
kind of thing. You're like,
Like
you're
she was-
describing my daughter right now.
Yes. Hairy arms, sacral dimple, the wide bridge nose, wide set eyes. They mentioned hypotonia, literally everything, anxiety, ADHD, everything that she had. It was just a checkbox all the way down to the kidneys, every single thing. It was like, oh my gosh, like that's her.
Was this a genome then instead of an exome? Do you remember what that test
The
was?
second one was an exome. And when we asked them, she said the first one was probably a lab error because the syndrome, we had it in 2014, but the syndrome was not even discovered until 2012.
Wow.
And so she said it could, like, it should have shown up, but she said the only thing I can think of is that it was a lab error or something.
Or that I'm thinking like when you order an exome, for people that aren't familiar on the healthcare provider end, we write in all the symptoms that are coming up because when we do an exome, we're looking at all the active parts of the genes. And so it's only about, 1% of the genome, but it's still a lot. And so it helps the lab focus on, oh, okay, if we're seeing these symptoms, these are the kind of genes that we should be focused on. So I'm also wondering if that might be part of it. But then again, your healthcare provider that ordered the first exome seemed very thorough and everything. So it's just surprising.
Yes. So we went to genetics for the first one. They had referred us to genetics and they checked everything off. We got swabbed. We had blood work. We got all the things.
So did you and Caleb provide a sample too? So it was trio testing?
Yes.
Interesting.
It was.
Okay.
When we got it back, she did let us know because immediately we were like, we had a younger daughter at the time who was about to be a year old. And we didn't see any of this with her. But we were like, when you say genetic, does that mean we carry it? He has a large family. Does that mean that it's, but then she explained that it was de novo. And
okay, so
Jenni
random,
Anne's,
it was not inherited. Is that,
yes.
Do you know, is that how it usually happens? Is it usually de novo?
The majority of it is. There are some cases where it is not, but the majority of it is de novo from what it seems.
So de novo, so then it's an autosomal dominant condition then. If you have a pathogenic variant or a mutation, then that's it. You don't need 2 hits. You only need 1. So what did that mean at that point? Like, they're describing Jenni Anne. This definitely is the diagnosis that felt right for you. And then what next?
So we thought we had answers and we were like excited, like, oh my gosh, there's answers. We're going to have answers. But then we got on top of the papers was a sticky note that had the Facebook group name on it. And it's so funny because when we hear back from every other parent, they're like, and the sticky note, and the sticky note. And so it's something that it's like,
so efficient.
Yes. And those are the earlier parents. When Jenni Anne was diagnosed, she was like 430 something in the world. And so, yes, so it was very interesting because I got out my phone and I started looking at the Facebook group and I joined the Facebook group. And I remember on the way home, I started crying because all these kids looked like her. It wasn't just that it described her or that they went through the same things. They genuinely looked like her. And if you look at the kids, they all have a similarity. And it's just, it was like, we have it. And I would type in keywords like febrile seizure or reflux or different things. And the amount, like, it was like the answers were there. And I would type in, like, I think one time I even typed in hitting chin and it was like, it would pop up. And so we were able to even type in medication, one of them that wasn't working at the time, and to see kind of what others were going through. But that became our lifeline. They ended up sending us to genetics to have genetics give us some kind of help. And we didn't even see a genetic counselor. The doctor basically said, we know nothing about this.
Having this be a rare disease, there are only so many people diagnosed with this. I imagine you were one of the first in your area of having a kiddo diagnosed. What was that like? I mean, you were talking about like the Facebook group. So you have this online community. And you probably right away were like, wow, these are my people. Did you have that feeling as soon as you started scrolling before you even interacted?
Did. Yeah, we did. And I remember 2 specific girls that were a little older than Jenni Anne, but oh my goodness, when I saw their faces, I started crying because I was like, this is her. And one of them is now her best friend. And so they have met. And so it's one of those things where it's like we were understood when we kept seeing it, just scrolling and reading comments after comments and being like, this is our people. This is who understands her. So she was the first or second diagnosed in our state and the first diagnosed at the hospital. So the doctor basically said, the geneticist said, if look at that Facebook group and that's where you're going to find your answers. You're not going to find it from us because we don't know anything. So you're going to find it from those people. That's your support. They are the experts. And then you're going to be becoming an expert.
And to be able to like, not only just ask them questions of, oh, how have you handled this, navigated this, especially for kids that are a little bit older than your own kid, because it gives you a preview of what's going to be coming up. So I've heard that from a lot of parents, and that depending on where they are and sometimes having to travel for appointments, but you have a good doctor for this. That is so helpful.
Yes. And that was a huge help, especially when we realized later on, when you mentioned the doctor, later on, there was another family that was in the group. In our group, we do like welcome posts. And so like I put Jenni Anne's picture, welcome, this is Jenni Anne, her age, we're from Georgia. And I got a comment from a mom, and she sent me a private message, and she said, do you see this doctor? And it was the ophthalmologist. Wow. And I was like, yes, we do. And she was like, okay, so funny story. We also see him. We were hunting like for what was going on. They had given her a couple possible diagnoses and they thought it was one. And the ophthalmologist was like, I don't think so. Like, I don't think that's it. What were the others? And so she told him, and he said, when she said Wiedemann-Steiner, he said, I bet that's it. And she goes, have you heard of it? He goes, actually, I have another patient and your daughter reminds me just of this other patient. And he was like, can't give names, of course, but he said, go to the Facebook group when you get the diagnosis. And I guarantee you'll be able to find them. She's involved in the Facebook group. And we ended up getting into contact with them and meeting them. And then a couple years later, the exact same thing happened with another patient. And at this time, we had given him approval to give the phone number, and they did. So now we're in contact, and it's 3 in our area, and they all see the same ophthalmologist.
Wow. And that is such a wonderful thing. I've done that with patients where I've said, there's another parent that has a child with this condition. Do you opt in to be connected with them? And if they do the same thing, then I can connect you. Exactly. And that is so helpful because if people are seeing me, they live in the same area of Connecticut, New York line. So it's just so helpful for them to be able to meet up for lunch. I can't imagine that kind of connection is not just for the kids, but also for the parents. As Jenni Anne gets older, things do change. And I imagine there are either different symptoms that come up or it changes a little bit of the severity of what's happening and having to adapt, as all parents do, right? But in terms of what other parents are experiencing as someone that has been in this community for a while, what insight do you have for them just in terms of your experiences and passing along some of that wisdom as other parents of either this condition or just other rare diseases are listening and looking for support? Because I know that's how Caleb and I connected. It's because you're a listener.
Yes. So I think reaching out, like Caleb looking for the podcast, like he was typing in like genetics, anything to help. We're very fortunate that our foundation, actually the WSS Foundation, actually has biannual conferences.
Great.
And we have had the privilege to be able to go to 3 of them. And our very first one is where we realized these are our people and they're the ones who understand it. But we had a sense of that community. And so I would probably say to anybody, like, if you get a diagnosis or if you don't have one yet, look and see if there is either a foundation or support group or something, because that's where you're going to find your support. That's where you're going to find the people who understand it. Now that Jenni Anne's older, the things that used to be cute are not, because she was doing them at 4 and she's still doing them at 12. And the peer interaction is a struggle because, she was doing it at 4 and the tics and the chin, or they're turning into different things. The clearing of the throat is like a big tic with her. But at 4, it wasn't a huge deal. At 3, it wasn't a huge deal. 8, it kind of was like a little flag. And now that we're 12 and we're still doing those things, it's like, why is she still doing that? Or is she choosing to do that? And just the understanding piece is huge, and the support, and just advocate and trust your instincts, because your instincts are telling you something for a reason. We ended up doing the chili cook-off, the fundraiser, because of that reason, because we wanted to raise money. We did. Like, that was something, it's rare. There's not a lot out there. We wanted data. We wanted research. But one of the biggest push is we wanted understanding for her. We were like, maybe if we do this, maybe if we share what WSS is, then people will understand, and she won't be stared at, and she won't be told, well, she looks normal. She looks fine. She should be able to act like this. She's 12. If she's 12, she should be able to do it. But just because she is 12, she doesn't act 12.
Right, that there's a difference there, and the expectations that people have of just changing those a little bit and learning how best to interact with people, especially that if they're developmentally not where their peers are, what is the best ways to interact? And I
Yes.
think that's a big thing that a lot of lay people just don't know. And even that's something that I'm learning. And
Yes.
being able to do that in a way that is appropriate, and also just, being able to engage and not just necessarily, I'm sure there's a lot of people that just kind of ignore and say, well, I don't know
Yes.
how to handle, so I'm just not going to, instead of kind of asking you and looking at both of you as parents and getting the cues from the parents.
Yes. So, and to kind of help along those lines, we started giving brochures for Jenni Anne at school to give to her teachers. So it's a brochure about Jenni Anne and WSS. And she's got a PowerPoint presentation. If the teacher okay with it, she'll let her get in front of the class and do a presentation on what WSS is and how it affects her.
And that's so empowering for her to be like, this is what makes me different. And this is how I'm going to also educate people about my condition. I imagine that that is also just a confidence booster, and that I can see how that's just great as parents, that I'm sure, you were kind of behind having that happen.
Yes.
And that's such a wonderful thing.
And from the beginning, we were upfront with her, because it took her a while to start understanding that there was a difference, because she didn't even realize it. And that was a blessing and a curse. Now I'm like, I wish she still didn't realize it, but it was something that we allowed her, like, we explained it to her. This is why things are difficult for you. This is why this is hard for you. And by explaining it to her and giving her that, it allows her to have the power. And she calls it her superpower sometimes. And so doing that, she's like, occasionally she'll go like, why do I have to have WSS? Why is this hard? But for the most part, we do point out the positives of it too. And it's not just Jenni Anne, but if all of them, they are happy, they are social, there are struggles, but there's also so many positives, and it makes them who they are.
And that's a huge piece. There's so many different genetic disorders where some of the symptoms are they're just happy social people more so than their peers, maybe, right? And
Yes.
I think that's also such a great thing to be able to validate the struggles. And yes, this is harder for you than someone else, but also this is what makes you you. And that is such a valuable piece of just having a positive spin on that part of her identity.
Yes, and she's known as like the mayor wherever we go. Like, local coffee shop, they all know who she is. They know her order. Church, every single person knows her. If we go
She's a little
to
celebrity
any
in town.
she is. And
She
it's
gets
funny.
recognized. That's very cool.
She does. And it's like, oh, you're Jenni Anne's mom, or you're Jenni Anne's dad. But you can just see their love for her. Like, the other day she was having a hard time ordering, and she was getting frustrated. And she was like, the barista was like, it's okay, Jenni Anne. I know what you want. If you want to tell me, you can, or I can make it. And she took a deep breath, and then she was able to get it out. But there may have been 10 people behind us in line, and they did not rush her. And it was like, I looked at him and I was like,
the world can be good.
It is.
Yeah.
Yes.
Wow. Well, thank you both so much for coming on and sharing about WSS and Jenni Anne and the experience that you've been through. It is so helpful. And I hear from listeners like Caleb all the time that, wow, I listened to this episode with these parents and I kept thinking, oh my gosh, same. And I kept saying things out loud while listening to episodes. And so it's really value your time and your expertise in coming on and sharing all of this, especially for Rare Disease Day. I mean, it's your day. It's your holiday. So thank you.
It is. Thank you so much for having us.
Thank you again.
And we'll put links in the show notes for people to learn more about WSS and anything else that we see that might be helpful. We'll put a link to Norden. So thank you both so much.
Thank you for having us.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.